Welcome to the Cystic Fibrosis Foundation's virtual CF Education Day, a webcast hosted by the CF Foundation and supported through an unrestricted educational grant from Genentech. I'm Leslie Hazel, Director of Patient Resources. We are going to be talking about the importance of exercise and cystic fibrosis, the benefits, and different ways to fit it into your life. Joining me is Mejia Downs, an assistant professor at the University of Indianapolis, who's a physical therapist and specializes in the health of people with CF, their hearts and lungs. Joining her to demonstrate different exercises and to ask questions is Ron Black, a 31-year-old with cystic fibrosis. Welcome and thank you for coming.
Thanks for having us.
Thank you.
So Annie, start us off. What are the benefits of exercise?
Well, regular exercise is an important thing for everyone to work into their lifestyle, but it's especially important for people with cystic fibrosis. Some of the benefits include strengthening the heart and the lungs, making the bones and muscles stronger, helping to clear secretions from the airways, and there are many psychological benefits as well. It helps to decrease stress and anxiety, helps people sleep better. It improves quality of life, and basically it helps people do what they want to do even better. There is one more important benefit to exercise for people with CF. Research has shown that people who are very fit, who exercise regularly, live longer.
So, Ron, how did you get started with regular exercise, and what do you do? What kind of exercise do you do?
My parents encouraged me from when I was young, around 5 years old. They got me involved in team sports like baseball, soccer, basketball. I continue to play basketball now. I also lift weights and I run regularly.
So what do you do to help keep, I know nutrition is so important and you burn so many calories when you exercise. What do you do to help keep your nutrition up? Do you worry about your salt intake and your sweat, and how do you balance all of that?
Well, I usually eat 4 to 6 small meals a day, small to medium meals a day. I drink a lot of protein drinks and weight gainers, and I drink a lot of Gatorade, a lot of water.
So do you have anything to add to that, Annie?
Yes, it really is important to make sure that you get adequate nutrition when you're exercising, because that does burn up calories. It also can help improve appetite to exercise regularly. And in the summer, especially during these hot months, you want to make sure that you have plenty of hydration, water, and Gatorade.
So what are the specific exercises that are best for people with cystic fibrosis?
Well, there are 3 basic types of exercise. One is stretching or flexibility. One is strengthening or resistance exercises. And the third is aerobics. So what we'd like to do is show you a demonstration of some of the stretching and strengthening exercises over here.
Please do.
So I'm going to have Ron stand by the wall here with his back to the wall and put his arms out to the side with them in contact with the wall. And I want you to bring your arms up to the top over your head, keeping your arms in contact with the wall as you go up. And where do you feel that stretch?
My upper body, my shoulders, my chest.
So this exercise stretches the muscles in the front of the chest to help open it up, to help breathe better. Okay, and then come on down. There's another exercise that you can do with the wall, and it's for the calf muscle. So if you can face the wall, and you're going to put one foot behind the other with the heel down and the leg straight, and then the foot that's in front, the knee is bent, and you're going to lean into the wall until you feel a stretch in the back of your calf. Do you feel that there? And the further you lean into the wall, the more of a stretch you'll get there. Okay, now let's show some exercises with you sitting on the chair. There's a stretching exercise you can do where you're going to bring your right arm and reach over to the left side as far as you can, and you should feel a stretch right here in your trunk. And then you're going to do the same thing with the other side. Bring your left arm over to the right side. And with any stretch, you should hold it for 30 seconds and to make sure that you feel that stretch. And you can do it both sides. There are some other strengthening exercises you can do in the chair as well. One of them is to get in the position with your legs out in front and use your arms. One way you can do this exercise is to do push-ups almost with your arms, and you're going to feel that in your triceps back here at the back of your arm. The other way you can do it is to leave your arms still and move your hips back and forth so that you're going to feel the strengthening in your hip muscles.
So you've got some great stretching and strengthening exercises. What aerobic exercises and how much does a person with CF need to do to help keep their lungs clear and to help stay healthy?
Okay, well, let's go back over and talk about that. Aerobic exercise is what is done with most of the muscles working in a very rhythmic manner. And you're going to keep it up for a period of time, not very short, like a 30-second stretch or a simple strengthening exercise, but you keep it up for an amount of time, either vigorously 3 times a week, so you're really sweating and working hard, or if you're going to do moderate exercise, you need to do it about 6 or 7 days out of the week at a lower level, at a moderate level of exercise.
Is swimming considered an aerobic exercise?
Yes, swimming, walking, biking, running, dancing, jump rope are all examples of aerobic exercise.
So how does someone know when to draw the line with exercise? How does a parent know when, okay, my teen's pushing himself way too hard, he's got to stop. He's trying so hard to stay up with everybody else. When does a parent know to draw the line of too much exercise?
Well, you need to have a way to monitor your intensity of exercise, how hard you're working. And one of the best ways to do that is using the scale of perceived exertion that we have on the slide, where there's a scale between 0 and 10. And how you use it is you ask the person when they're doing any activity, how hard are you working to do this activity? So I would ask Ron, as you're sitting here on the right here at rest, how hard are you working at that 0 to 10 level?
0.
0, okay, and then I would ask Ron, or he would ask himself as he's out doing his running, how hard am I working to do this running? And what we're working for is a target level of 4 or somewhat hard. So when you're exercising, when you're running, do you feel like you're at that somewhat hard level?
Yes, definitely.
Okay, so that would be one good way to measure your intensity. Another simpler way would be the talk test, where if you're able to sing or whistle, then you're not working hard enough. Mm-hmm. And if you're not able to answer someone who's asking you a simple question, then you're working too hard. So you want to work at that middle level of being able to talk a little bit when you're exercising.
So a talk test might be a good tool for a parent to use in judging how their child, if they're exercising too much or if they're working too hard.
Exactly.
So let me kind of tweak this a little bit, and I'm making an assumption, Ron, that you have had lung infections and have been treated for a pulmonary exacerbation. So assuming that's correct, how do you recover? How do you get back to your exercise level? Do you exercise through while you're sick? What do you do? Or Annie, what advice do you give people who are dealing with that situation?
Well, it would depend on how sick I am. If I'm really sick, then no, I'll take the time off to rest and let my body recover and get a little healthier. And when I start back, I'll start at probably around half of what I would normally do and build myself back up. And if I do exercise while I'm sick, I'll do about, again, half of what I normally do.
Right, so if someone's not feeling as well, then that amount of exercise is going to make them work harder, so they won't be able to do as much. And then you just build up from there, back to where you were.
So this is a question that I've gotten from a lot of people. And is exercise as important as chest physical therapy or airway clearance? And can my exercise replace my airway clearance?
Well, as I said before, one of the benefits of exercise is that it does clear your secretions. But we feel that it's important to do airway clearance in addition to the exercise, so that exercise is a supplement to your airway clearance. But as we talk about trying to balance all the things that people with CF need to do in their lives, if you've had a very vigorous workout one day, then you might be able to cut back on your airway clearance for that day. So it's a matter of balancing it out. But exercise does supplement the airway clearance.
Who is the best person at the CF Care Center to work with a parent or a patient or a person with CF to try and figure that out?
You need to work with the physical therapist and the respiratory therapist to try to find out what the balance would be and what things are recommended for that individual.
Well, let me go a little bit different, and here's another very frequent question that we've gotten is, how does a parent or a significant other or a friend help someone with CF either start an exercise program or stick with their exercise program? I know it's hard for me to get started and stick with it, so any suggestions for someone with CF?
I think first of all you have to find what that person likes to do. Not what the parents want them to do, but what will they do, and start there. And then have some incentives. It's very hard to keep up exercise week after week and year after year. Have some incentives and set some goals for what you're trying to do with your exercise, and that will really help. And the other thing is to try to vary the exercise programs around. I know that you do different exercises at different times.
So can you give us an example of how in your busy life do you fit exercise in, Ron?
Well, I usually make it the top priority. Usually on a regular day, it's one of the first things I do after I eat. About an hour later, I go to the gym or whatever exercise I'm going to do that day, whether it's running, weightlifting. And again, like she said, I vary it up. After about a month or two, I change things around. But I sacrifice. I make the time because, I mean, work and everything else is important, but your health has to come first.
So you say you sacrifice. Give me an example of what you don't do in your schedule.
Well, I mean, as opposed to maybe watching TV for an hour, I'll spend that time in the gym. You know, and a lot of gyms have TVs in there anyway, so you can still watch TV and still go on with your life. I mean, I make the time.
Any last tips for the people who are watching?
Well, I think it's very important to try to work it into whatever your lifestyle is. So you can maybe take the stairs instead of the elevator, park farther away, and walk when you can. Try to watch TV when you're doing your exercise. Try to work it into your day so that it becomes a regular part of your lifestyle. Any
other input, Ron?
Pretty much covers it, I think. Like I said, you just have to push yourself. You have to realize that your health is the most important thing. You know, for teenagers, it's more important than hanging out with your friends sometimes. You know, you need to take that time and really take care of yourself.
So, thank you, Annie, and thank you, Ron, for coming and demonstrating and sharing some tips about exercising for people with CF. I also want to thank you for watching and the University of Indianapolis for hosting this topic. To learn about CF drug development, lung disease, nutrition, quality improvement, building life skills to manage CF, issues and answers related to insurance and government programs, and how to avoid germs, please watch an archive webcast on our website. Again, I would like to thank you for watching and submitting your questions. All of the presenters and hosting institutions, Rick Vasta and the technical crew, Genentech for their unrestricted educational grant, Sarah Waybright, and the CF Foundation for making this webcast possible.